In studio with us today, we are talking with a certified trichologist. We're going to tell you what that is in just a moment. Her name is Dr. Prenik James, and she's in studio with us to talk with us for a few minutes about some very interesting subject matter. I want to thank you for coming in.
Thank you, Doc, for having me. I appreciate that.
Fruit of the Spirit Hair Care Studio and Clinic. It's located on Virginia Beach Boulevard, just across Rosemont. We'll get her to give you all the details. But I want you to tell everybody, first of all, about your title, a certified trichologist.
Doc, I get that all the time. Trichology, I've actually studied the science of the hair and the scalp. I do service patients that are suffering from various hair and scalp disorders, hair loss, or just in general trying to get their hair to a healthy state.
Is your customer base more men or more women?
I would say my customer base is about 70% women and about 30% men.
I noticed my hairline started receding, as most men, they look in the mirror and like, where's my hairline? But I didn't pay any attention to it. So, it eventually got to a point for me where I just decided to go bald. Given a choice, I would much rather have hair. When people come to you, what stages are they coming to you? Are they coming to you because they're losing their hair, or they want to grow healthier hair, or?
Again, that's a great question as well. It's a combination of pretty much everything that you just mentioned. However, the first signs of hair loss with men, for the most part, would probably start in about their 20s, and then with women, we're about 10 years behind. So again, with males, if you already know that you have a genetic disposition in your family, you want to catch it very early. Hair loss, just like any major disease, it goes in, or it actually happens in phases or stages. So stages 1 through 4. So the earlier you detect it, you come in for treatment, you have a better chance of saving your hair. Now, of course, when you get in stages 3 and 4, it's kind of iffy at that point, especially again when you're dealing with genetic dispositions.
If you're just turning on the radio, we're talking with Dr. Prenik James, who is a certified trichologist. People always say, well, you worry too much. That's why your hair is falling out. But it's not always that.
Yes. When patients first come in, we first do what is called a bioscan, wherein I actually scan the body systems. Which, with my naturopathic background, we want to take that multi-therapy approach to overall hair health. So I take the holistic approach, meaning that it doesn't start with shampoos and conditioners. By me doing the bioscan, that's going to tell me exactly where your nutritional deficiencies are stemming from, so that therefore we can get to the culprit. Our body has 10 different systems. So let's say, for instance, I have someone, or a female, that's coming in dealing with menopausal issues, dealing with a lot of stress, etc. That right there is telling me that they have an issue stemming from their endocrine or glandular system. That's the system that houses our adrenal glands. That's the system that helps us to deal with stress. That's the system that helps us to sleep. Of course, if we're not sleeping, the hair can't grow. Menopausal issues, thyroid issues, all of that stems from that particular system. So, of course, if that system is out of range, then that's going to be definitely a huge contributing factor or culprit to the issue of hair shedding.
I never thought about sleep having anything to do with hair loss or anything like that. One other thing that's really popular right now, that's weave and sew-ins and all of this. I've heard people say, we've all heard people say, that, well, if it's not done right, it'll break your hair out or make you have hair loss. Does any of that have anything to do with hair loss, particularly in women?
Yes, definitely. I would say about 50% of the women that I treat with hair loss have what is called traction alopecia. Traction alopecia is when you've actually caused trauma to the hair follicle. Now, of course, I am not anti-hair extensions, weaves. That's where I started. I actually specialize in 35 different weaving, extension, and hair replacement techniques. However, I always take in consideration of the health of the hair first. That comes first before any styling. That's just more so so when you're dealing with hair extensions, that's more so to take care of the aesthetics or the appearance. You still want to make sure that you're treating the hair and scalp underneath. Any hair extension method, if not properly done or properly maintained, can be very damaging. So I always, when patients come in or clients come in that are interested in, of course, taking care of their appearance while they're in the midst of treating their hair, I'm only going to recommend the methods, therefore, that are going to be healthy contributing factors to what they're trying to do or their actual goals itself.
One of the other things that came to mind right now, there are probably men and women listening right now who, have experienced some hair loss, or they're beginning to see signs that it's going in that direction. The first thing some people are thinking, I can't afford this. We've seen TV commercials, and some of these programs are like thousands of dollars, $8,000, $9,000, $10,000. A lot of people just can't afford that. Is this within reach for the average person, or are we talking about thousands of dollars here?
It's definitely in reach. Actually, I developed the Healthy Hair Challenge years ago, probably about 10 years now. I developed the Healthy Hair Challenge for those that are very serious about getting their hair to a healthy state. So not only does it make it affordable, by it being affordable, they're able to budget their hair care. They pay one price, and that gives them a series of treatments, depending upon which price point they decide to go with, but it provides them with a series of treatments because, of course, it does take consistency. Healthy hair growth, restoring the hair is not microwavable. It takes time. It takes about 3 to 6 months to pretty much reverse what's been going on, and then we can, I always say we want to stop the hemorrhaging first, and then we can actually treat the wound. So they have to come in, they have to be consistent. Of course, it can be costly if they're paying at a la carte prices. So again, by them taking the approach to the Healthy Hair Challenge, that's going to, provide them again with a series of treatments at one cost, whereas it's more in reach for them.
If you're listening to us right now here on Praise, are you a man or woman who has experienced hair loss? Are you someone who's looked in the mirror and you said, man, what happened to my hair? And you'd like to get the glow back. Look, everybody likes having their own hair. When I had hair, and I'm completely bald now, and perhaps I should have come to see Dr. James a little earlier, but if I had a choice, I would love to have the hair I had back. I can't tell you how many people said, sometimes you get a compliment, man, your hair, you got a nice, who is your barber, So we enjoy, and of course the Bible even states that a woman's hair is her glory. So people who are listening right now, you want to find out more about this program. I'm talking about Fruit of the Spirit Hair Care Studio and Clinic. Now, this is not somebody just doing this. Dr. Prenik James is a certified trichologist. So this is professional if you want to really get to the root of the problem. Before we go, in case we have some people who need to leave, give us some contact information and, how they can kind of get in touch with you and get something going.
Okay. They can reach me actually at 757-452-0170. They can also reach me on social media sites at Fruit of the Spirit Salons, Facebook, as well as Instagram. Or again, they can just call me or email me.
Another question. A lot of people are a little bashful, a little shy about this. Can there be private consultation? There may be people listening who said, I'd really like to see her, but I don't want to come in and there's like 15 people in the salon. Is there that type of service available?
Absolutely. Actually, that's the only service that I provide. The first step is coming in for an initial consultation. Before any services are rendered, I will meet with them one-on-one. We will address their goals that they desire for their hair. I'll also conduct a microscopic analysis to see exactly what stage they're in to better serve them or to provide them with the etiology, which is going to provide them with the contributing factor or the cause of the hair loss. And then we'll get into various solutions or treatments, and then I'll provide them with the prognosis, meaning if nothing is done, this is where you're at and this is what could happen. Also during that consultation, again, we'll do the bioscan, which will scan their body system, so it'll tell us exactly where the nutritional deficiencies are stemming from. And it's also very important to identify the type of hair loss so we're not just spinning their wheels. So again, I take that multi-therapy approach. All services are provided on a one-on-one basis, private. They never have to worry about sitting in the room with someone else staring at them. Is always one-on-one to, provide that privacy for the patient.
All right. And one other question is it possible that your healthcare provider could underwrite some of this?
That's a great question. Because I take a holistic approach, a lot of healthcare providers do not, or insurance companies do not cover the service. They will cover, in some instances, depending upon what healthcare provider you have. A lot of times they'll reimburse you for the appearance, like hair weaves or hair extensions, so we can actually write a prescription for that. But as for the treatments alone, because we take that holistic approach, they don't cover that. And just to kind of give you just a little bit more insight real quick, Doc, on the difference between a dermatologist, because I get a lot of that, a dermatologist and a trichologist. Tri in Greek means hair, derma in Greek means skin. So a lot of times if you are having hair and scalp issues, you need to see a trichologist. If you're having skin issues, of course, you need to see a dermatologist. And not taking anything away from dermatology, but they more so treat topically, wherein with the trichologist, we get to the culprit of what's going on to provide you with that multi-therapy approach to truly get the hair growing back, so we're not, spinning your wheels or, providing you with just topical solutions, which is causing the issues to worsen, at some point.
Okay, I've got to get this question in before we go, and we are quickly running out of time. If you're listening to this segment today, Dr. Prenik James, she is a certified trichologist. She runs the Fruit of the Spirit Hair Care Studio and Clinic located in Virginia Beach. If you come up Virginia Beach Boulevard, cross Rosemont, come up maybe another block or so, she is right on the left-hand side. Now, I've seen a lot of young people, a lot of teenagers, a lot of young girls. Everybody's doing things with their hair. We think sometimes when you talk about hair loss and things like that or restoration, we think of an older person. How about the teenagers? I saw a young lady the other day. I'm thinking maybe she was 17 and she's dealing with hair loss already. Is that because of, the weird things they're doing to their hair or the products maybe improperly they're using?
Absolutely. I've seen a lot of teens coming in now, even younger girls, 9 and 10 years old, that are experiencing hair loss. And a lot of it comes from improper hair care, of course, back to diet, nutrition. All of those are contributing factors, a culprit, for hair loss, especially with the natural hair care coming out, or those that are going natural or transitioning from chemicals. A lot of times they think, okay, I'm transitioning or I'm coming out of chemicals. I just want to wear my hair natural, but you still have to care for the hair. Healthy hair starts, of course, or healthy hair begins with a healthy start. That's always been my slogan. So a lot of times, they're actually using too much or excessive heat on the hair, which can cause hair loss. They're braiding the hair. Braids, of course, can be definitely, if it's tight, it can be a contributing factor to traction alopecia, which I see a lot in our younger girls or our, teenagers, gluing the hair in, bonding the hair. A lot of them are allergic to, the glue, which contains latex. A lot of people don't realize that. That's pretty much what I've seen in our younger generation of, young ladies stressing the hair out with heat, braids, weave, and glue, and just pretty much not taking care of the hair and just over processing it if they're still using, chemicals or relaxers.
There it is. If you're interested in getting information, and let me just tell you, for a man who has a bald head, I've learned more in this 13 minutes here than I've ever heard about hair in my life in terms of, things like this. I like the natural look. A lot of the men and women, you got the little twisties, then some are doing the more natural look. I guess a lot of people think, well, I'm going natural. I don't have to put anything on it. Don't have to do anything. Get in touch with Dr. Prenik James. I'm about to have her give her information one more time before we close out here. And by the way, thank you for bringing this information.
Thank you for having me, Doc. Again, the audience that's listening, they can reach me at personally, actually. They can reach me on my personal line at 757-452-0170. Again, that's 757-452-0170. And all social media platforms, Fruit of the Spirit salons. They can actually DM me, Instagram or Facebook, and I'll respond right away or within 24 hours.
There you have it, Dr. Prenik James, a certified trichologist, Fruit of the Spirit hair care studio and clinic.